We can all agree that medical science has traveled an immense distance through history. These days, whatever your complaint, you can head to a drugstore and find a miraculous tablet to eliminate your woes. Headaches, too much gas, or erectile dysfunction are all addressed. But progress was slow. In antiquity and even in the early history of the United States, finding remedies was a process of experimentation, and there was a tremendous amount of failure, a truly staggering amount. Presented here are 8 unusual and genuinely horrifying historical treatments for diseases that will make you reconsider grumbling about that unpleasant cough medicine. Number 1, Chloroform. This convenient knockout potion, a favorite of serial killers and pursuers, was initially employed as an anesthetic for surgical operations. It saw a huge surge in use across the U.S. after it was given to Queen Victoria to ease her labor pains. And honestly, if I had to deliver 9 royal infants, I'd likely grab for the cloth, too. Chloroform was subsequently used on Civil War soldiers and in other global wars. However, an increase in sudden, unaccounted-for deaths during surgery sparked debate about the drug's safety, and its vogue as an anesthetic declined. Beyond merely sedating patients, chloroform served various medical roles. It was a treatment for asthma, cholera, and even gonorrhea, and acted as a sweetener for other drugs. As Mary Poppins might remark, a spoonful of chloroform helps the medicine go down. Number 2. Human remains. You understood that correctly. Several centuries ago, mainly in Europe, the custom of ingesting human body parts as medicine was surprisingly common. As historian Richard Sugg stated, the dilemma wasn't whether to consume human flesh, but which flesh to consume. From a powder produced by grinding skulls to portions of mummified corpses to recently collected blood, individuals ingested other people to heal various illnesses. This largely originated from an idea that remains from a particular body part would cure ailments of the corresponding part, for instance, consuming skull powder for headaches or drinking blood for blood disorders. In some cases, townsfolk would attend executions and then purchase a small cup of the executed individual's fresh blood, akin to a disturbed county fair. Perhaps the most shocking instance of this cannibalistic medical practice occurred in the 1600s when a German doctor proposed that jerky made from the bodies of red-headed cadavers would treat a range of ailments. Redheads have truly faced universal opposition from the start. Slim Jim, anyone? Number 3, urine. Transitioning from one bodily fluid to another, urine was utilized in ancient societies to cure a range of illnesses like asthma, arthritis, allergies, indigestion, migraines, and even cancer. Individuals typically drank their own urine but might also rub it into their skin or gums to achieve the intended effect. Ancient Roman dentists are even recorded to have used it as a mouthwash, which to me simply sounds like they enjoyed playing pranks on their clients. In the early 1900s, a British naturopath revived the practice of drinking one's own urine, naming it urine therapy. He founded his proof on personal trials with consuming his own urine, once asserting that during a period of poor health he cured himself with a 45-day fast consisting solely of urine and tap water, out with the old and in with the old. He authored books on the topic and prescribed urine therapy to thousands. Urine therapy has been most prevalent in India and, unlike earlier entries on this list, is still practiced today, despite many studies cautioning against it and describing the associated health dangers. Personally, I'll remain with Advil. Number 4, malaria. Yes, that malaria. In 1927, Austrian physician Julius Wagner-Jauregg observed a psychosis patient return to rationality after recovering from a high fever caused by a bacterial infection. This apparently was Wagner-Jauregg's eureka instant. He speculated that fevers could be a remedy for psychosis, specifically psychosis resulting from advanced syphilis. After what I can only assume were some very convincing arguments, he started giving malaria to syphilis patients to produce a fever. The malaria would cause a patient's temperature to rise so high that the syphilis bacteria could not survive. The syphilis would perish, and then the patient would be treated for the malaria itself, usually with quinine. Now, Wagner-Jauregg was not completely mistaken, as he achieved about a 25% success rate with this method. The other 75% of the time, the procedure either didn't work or the patient died from the malaria. This seems like a classic example of fighting fire with fire. And look, if it were me, I'd want to eliminate my infection as much as anyone, but I'd probably set a limit at knowingly giving myself one of the globe's most destructive diseases. But, hey, anything to avoid using a condom. The true irony is that for his work, Wagner-Jauregg was awarded the Nobel Prize in Medicine, and about 1 year later penicillin was discovered, and the malaria treatment was stopped immediately. Hopefully he retained the medal. Number 5, water. Now wait a moment, water? Water is beneficial. My physician tells me I must drink gallons daily, I always carry my motivational water bottle, etc. Perhaps I should be more specific, drowning. This cure was aimed particularly at rabies victims. One of the most recognized symptoms of rabies is hydrophobia, the dread of water. When rabies sufferers develop this symptom, they have an intense repulsion to water and most other liquids. This leads to the foaming at the mouth we commonly see in portrayals of rabies. The victims can no longer swallow their saliva. Attempts to drink can trigger intensely painful spasms in the throat and esophagus. Imagine the sensation of taking a tequila shot, then imagine that constantly. Hydrophobia also makes the illness more contagious, as saliva production rises and the disease transmits through bites. Now, here is the cure. Rabies patients have an extreme fear of water, and how do we conquer our fears? Exposure. So, logically, rabies victims were immersed in water, like clowns in a carnival dunk tank, hoping that if they took in enough water, the disease would be washed from their body and their hydrophobia along with it. The issue is, no matter how hard we attempt it as children, humans cannot breathe underwater. In the ancient world, these doctors did not distinguish between taking water into the stomach and swallowing it, or inhaling it and filling the lungs, resulting in drowning. This practice typically proved fatal. I suppose after that the victim no longer suffered from rabies, they didn't suffer from anything afterward. Number 6, trepanning, or trepanation, is quite simply the custom of drilling holes into the skull to treat brain illnesses. Nothing expresses, fix me, like taking a metal rod straight to the cranium. This specific operation has existed for millennia and crosses numerous cultures worldwide. There is proof of trepanation occurring as far back as 10,000 years ago, and it is broadly considered one of the oldest surgical procedures for which we have solid archaeological evidence. In early times, trepanation was mostly used in religious ceremonies, as people acting strangely were often believed to be possessed by evil spirits. These individuals might argue they were just having a difficult week, perhaps they were dismissed from the temple construction team or spilled wine on their best loincloth, but their protests would be ignored. The local surgeon would arrive, take out his reliable drill, make a quick hole in the head, and presto, the evil spirits would depart into the night. Trepanation was also used in attempts to cure mental illnesses. Usually, the removed skull fragment would be kept and worn as an amulet to prevent further evil spirits. To me, that is possibly the most metal thing I've ever heard. I'd wear a piece of my own skull to avoid possession any day. Trepanation is technically still used today and is a very functional method to treat brain injuries. Often, surgeons must open the skull to relieve pressure from swelling or bleeding in the brain, which can be a life-saving procedure for those with traumatic brain injuries. However, in modern practice, trepanation is performed with extreme precision and, not to mention, the advantage of anesthesia. In the old days, though, I imagine this was somewhat uncomfortable. Number 7, heroin. I suppose we had to determine how hazardous substances are somehow. Heroin was created in the late 1800s in Germany by the pharmaceutical company Bayer as a suppressant for coughs and other respiratory ailments. It was originally developed as, get this, a non-addictive substitute for morphine. Now, I'd like to pause to examine the irony of that statement. First, claiming something is less addictive than morphine is like stating your cooking tastes better than a heap of hot garbage. It's a very low standard. Secondly, Bayer was completely incorrect. Over time, after it was commercially available and employed as cough medicine for years, doctors started to notice how readily people became addicted to and misused heroin. The medical community quickly recognized the dangers, and by the early 1900s its medicinal use was strictly limited. So, kids, don't use drugs, just have a lozenge. Number 8, red-hot irons. I simply had to include this one. Anyone who has experienced hemorrhoids knows what a pain in the rear they can be, literally. A hemorrhoid happens when the veins or blood vessels in or around the anus become inflamed, swollen, and irritated. They can be internal, located just inside the rectum, or external, dangling outside the anus like a cluster of unpleasant grapes. Hemorrhoids are usually just a nuisance, making it painful to sit or use the restroom. They can be addressed with creams, pain relievers, and home remedies. But in the old days, because why not, treatment for hemorrhoids involved inserting a red-hot iron directly into the anus to essentially scorch and cauterize the hemorrhoids until they were no longer hemorrhoids. Certainly, because at that point they were third-degree burns. Either way, I can't sit. This procedure was made famous by Hippocrates, known as the father of medicine, and he took it a step further by specifying how to perform it. He said that when applying the cautery, the patient's head and hands should be restrained so he would scream, as this would make the rectum protrude further. Picture getting past the initial shame of having hemorrhoids, going to your doctor, and then finding yourself restrained and branded like a cattle, with the doctor whispering in your ear to further protrude your rectum. This is the material of nightmares. These treatments differ in their ridiculousness, but one point is clear. I am certainly thankful we live in a society where I haven't had to undergo any of these.